Welcome to this lesson on the OET speaking subtest. In this video, we'll learn what happens in the speaking test, how to prepare effectively, and what you need to do to perform confidently. By the end of this lesson, you'll be able to identify the structure of the OET speaking test, apply effective preparation strategies, and use key communication skills to perform naturally and confidently. Let's start by looking at what happens in the OET speaking test. First, you'll have a short warm-up conversation with the examiner for about 3 to 4 minutes. This part is not assessed. Then, you'll receive a role-play card and have 3 minutes to prepare. After that, you'll perform the role-play for about 5 minutes. Finally, you'll do the same with a second role-play card. Each role-play is based on a real healthcare scenario, such as talking to a patient or caregiver. You will always take the role of a healthcare professional, and the examiner plays the patient or relative. Part B questions love inference, meaning that's implied, but not directly stated. Look for clues in adjectives, verbs, and results. Ask, what does this suggest? Not, what does it say? You only have 3 minutes to prepare before each role-play, so you need to use that time carefully. Let's look at what to do during those 3 minutes. First, read the setting. Find out who you are, where you are, and who you'll talk to. A patient, a parent, or a carer. This helps you understand the situation. Next, read any background details, such as the patient's condition, previous treatment, or how they're feeling. This helps you predict what the patient might say. Underline the task verbs such as explain, reassure, or advise. These tell you exactly what to do in the conversation. Think about how the conversation might go. What questions will the patient ask? When will you give advice or show empathy? Finally, brainstorm useful phrases you can use. Think about how to start, how to show empathy, and how to explain or advise politely. During the role play, start with a polite greeting and build rapport. For example, say, "Good morning, I'm Dr. King. Can you tell me what brings you here today?" This helps you connect naturally with the patient. Show interest in the patient's feelings or worries. Ask open questions like, "What concerns you about this?" or "Is there anything specific you're worried about?" This demonstrates empathy. Use signposting phrases to guide the patient through the conversation. For example, "Let me explain what we'll do next," or "I'd like to ask you a few questions first." Ask open questions first. For example, "Would you mind telling me more about your symptoms?" Then use closed questions to check details, such as, "Where exactly is the pain?" Ask when giving advice, use simple, polite language. For example, "It's a good idea to use a heat pack," or "You might want to rest for a few days." Avoid being too direct or using words like must or have to. Pause during the conversation and encourage the patient to respond. You can ask, "How does that sound?" or "Do you think you'll be able to do that?" This makes the interaction two-way. To improve your speaking, build a list of useful phrases for explaining, advising, and reassuring. Practice role plays with a partner, record yourself, and review your language and tone. If a patient says something like, "I'm really worried it might be something serious," respond with empathy. You could say, "I understand why you're worried. Let's take a closer look and see what's going on." Remember, good speaking is not about perfect grammar. It's about connecting with your patient. Keep practicing, stay confident, and you'll do great on your OET speaking test.